one nation, under God, indivisible, with liberty and justice for all. Under Texas flag, I pledge allegiance to the Texas, one state, under God, one indivisible.
Thank you.
Next up, we have got some amazing students from ECISD High School and their theater director and co-director. So we can reach out to all of our ECISD kiddos from theater and their director and co-director. Come on up. Come on up. Come on up. So honorable mentions of all-star cast. We want to congratulate these students and their directors and recognize them if their parents are in the audience. Please stand up, parents, friends. Please stand and congratulations. Congratulations. Next, we'd like to call on a pair of fourth grade students from Oakcrest Elementary, Miss Alexia Delgadillo and Emily Garcia. Both students were named Oakcrest Author Spotlights of the Month, Alexia for February and Emily for March. Both of these young ladies have their work published in Live from the South Side magazine. Their teacher will please stand up and be recognized. That concludes the
That we will take a short minute break to call on everyone that needs to get on the agenda. Then we'll come back and give you.
Tampa Bay. Good talk.
5 other comments. Ms. Coach, do we have any public comments?
Yes, sir, President Haskell, we have two public comments.
All right.
I'll read the first one from Mr. David Rackowitz. I would like to commend the East Central administration and the school board for steering us through this pandemic. It's been a huge undertaking. As we slowly emerge from this, I am glad that the district is looking ahead to the future and is encouraging public feedback from the God Exchange survey. From early on, the majority of comments have been about the need for more schools, particularly middle schools. Explosive growth is happening in several areas of the district. Hundreds of acres have been sold along Loop 1604 between Schuberth Road and Lindsay Land, and there are already many homes and apartments being built along that corridor. Several of those comments have been on the need for the middle school to be built next to traditional elementary as soon as possible. So many students are having to be bused across the district to Heritage and Legacy, and it's only going to get worse. It is time to consider a second high school as well. Building a new school means that a name must be selected. There were a lot of mixed feelings about the selection of traditional elementary. A petition was circulated and 350 individuals advocated for the name of St. Anthony Elementary. That name would have represented the diverse community around the school, which was the first school in East Central ISD not to have a San Antonio address. This is why I am recommending St. Henrik Middle School, where the middle school is built next to traditional elementary. It honors the city that has opened its arms to these new facilities, and it promotes community pride. There are many others who feel the same way. The name does not have a religious connotation. It is simply about geography, much like Sinclair, Yukon Valley, or Slaughter. There are already more than enough conceptual school names such as Heritage, Legacy, Harmony, and Tradition. It is time to embrace a new chapter in our school district. Viva St. Henrik Middle School. And then next we have Ms. Irma Jean Diona, who signed up as well.
Thank you, Ms. Phillips. Good evening, Mr. Toscano, President Haskell, and the rest of our school board. April is School Library Month, and I'm honored to share with you the impact our East Central Library Services has had on our community. Our librarians and the Marcom Department have put together a short video highlighting a few of the events that have been sponsored on their campuses by the librarians in spite of the uncertain times this past year has given us. Through our expanded partnership with the San Antonio Public Library SOAR program, now on all the East Central ISD libraries, they're participating in using SOAR ebooks and audio books. Through this expanded opportunity, we had a 4,400% increase in the use of ebooks in this past year, which may not surprise you very much. So while access into our buildings might have been limited, and when our buildings may not have been open, our libraries never closed. In the video, you will also see our children celebrating diverse cultures and holidays, as well as Read Across America Day and curbside book pickup with student meals. You'll see children browsing new books in the libraries as librarians work hard to keep their collections current and reflective of their school community. You'll see students reading in the outdoors, and the library continuing to be a warm and inviting space for staff and children to enjoy the love of reading. It would be difficult to speak of the past year without acknowledging the significant role of school librarians in supporting our district's remote learning needs, from handing out devices to answering help desk calls. Let's take a look at the video.
I am Eliza from Christ First Grade on behalf of all the students of East Central. I want to say thank you to all the wonderful school board. I am Oliver, a fourth grader at Oakcrest. Me and Norman has a book about a spirited wolf and a special day with her mother. This award-winning book celebrates the special bond between a mother and a daughter. I hope you enjoy this book by Cosby Cabrillo. Happy School Life, everyone!
So that book, me and my mom, that Oliver is virtually handing me. It's a token from our library services, from our appreciation for your leadership and support over the years. It's a cozy book and a sweet little read that we hope you'll share with a loved one. Without your support, we wouldn't be able to leverage our resources to reach our communities and our students with the impact we've had in the past year. So thank you.
Thank you.
Move on to item 6, superintendent report. Mr. Scott.
Sir, I'll put it at this time to provide the board an update on quarter 3. In your electronic packet, just under 6.1, you'll see 2021 district external scorecard for quarter 3. And when you click on that link, you'll see a table of contents on the left, which has all 3 quarters. It has the signaling scorecard, as well as the summary big ideas and next steps as a result of kind of the current findings, current status, if you will. So Dr. Post will provide the board with a moment.
Good evening, President Assia, Mr. Scott, Board of Trustees. So I would recommend that you click first on the Q3 external scorecard. Take you to this page. Remember, on the left-hand side, you have the community-based accountability key questions. And then across the right, you will see all the campuses and then the 3 big departments of the district. And this is the quarter 3 signaling. And if you'll remember that down the bottom left, you have the key. So if you see OT is on track. A, that means you're making adjustments for this quarter based on the quarter 3 findings. SR, the data trusted sometimes support. C, if they're in crisis, and then percentage if they've achieved what they intended to achieve. Go through there and see where everybody is signaling. In the past 2 or 3 weeks, we had the pleasure to sit down with each of their principals and talk about their external scorecard. Each of them gave kind of an overview, what they were celebrating, and then what are some of the things that they have discovered, and based on that, some of the adjustments and or changes that they're making for this quarter 4. So if you click on Q3 big ideas, we've captured some of those ideas for you here. I'd just like to sum up that many of the campuses express that 3.1 and 3.3 are areas that they're focusing on. Both of those deal with student learning and growth. There is, as you know, nationally some concern with the pandemic and learning loss and students maybe not being as present in school or struggling with virtual learning. We talked about that in quarter 2, and so at that time we made a recommendation that any students that were struggling be brought back to school. We made an effort to do that, to bring as many students back, and we're continuing to encourage students to come back to school. And so what the principals and their instructional leadership teams have been doing is then delving in deeper. So the students that are still virtual or they're in school, and if they're struggling, each of them have made a plan on what are they gonna do for those specific students, so we try to capture those ideas here. I'll go over some highlights of some of those. They range from having what are called grow meetings, where they're sitting down with their teachers and instructional staff and talking about each individual student, what they see as working, what they see as strengths and areas of opportunity, and then they're making a specific plan for that child, whether it be virtual support or face-to-face support. So that's one basic you'll see as a repetitive pattern that you'll see up here. Other things that people are trying are individual goals. So we know that when students know their goals and what they're focused on, which they're more motivated and to learn and grow, and we take ownership over that. So several principals spotlighted, if you will, different strategies that they're using to help students set their own goals and track their progress along the way, so they know exactly where they are in their learning, to help them understand what types of things we can focus on and learn over the next several weeks, months in school. And then down at the very bottom, you'll see some of the district departments. And as we work with campuses, one of the biggest things that we've heard from them is the social and emotional support that our students need based on what they've experienced through the learning through this year. And so we have come together and tried to talk about over the last several months how can we continue to support that. We have two big areas that we feel like we're focusing on. One of them is around MTSS, and that's our multi-tiered support system. That really looks at the academic support as well as the behavior and social emotional support. So how do we check in and check out with students each day? So when a student comes to school or they're virtual, have an adult that talks and meets specifically with them when they walk in the building one-on-one to talk about what their day's going to be like, what they're going to be working on that day, and then they leave them at the end of the day to see how it goes. We also have really talked about how do we help students with those social emotional skills throughout their lessons. It's not a class on the side, it's not a lesson on the side, it's embedded in their learning, so we can help them get along well with their peers, set them up for success, work on their mindset about showing up prepared, positive, and ready to learn. So those are things that we really work on and we're continuing to work on for this year. The other thing that we've talked about is, and are in the process, is adding a coordinator position for social and emotional development for next year. We know that this is an area of need for us, and as a district, we've tried hard to really support that through different areas and programs. We feel like this one position that would be the gatekeeper for those can really help some of the fractures that happen in some areas, and help to bring everyone as well as some kind of gatekeeper, if you will, of those programs to ensure that it's streamlined, it makes sense, and that it is organized in such a way that it makes sense to the implementation and campus-wide and district-wide. You've heard about, we talked quite a bit about our partnership with communities and schools, and we're excited to say that our communities and schools case management has grown, and so they are serving more kids and are almost at max capacity at each campus, so that we can ensure that all the kids that need help have the direct support that we provide. So those are the big things. Everything we have that.
Questions? Not further discussion. How successful were we in bringing back students that we thought we needed to be? We feel like we are not as successful as we want to be, but we've had substantial increases in the percentage of students and the number of students that come. In fact, and a little bit later in the superintendent's reports, I'm going to do a COVID-19 update. And at that point, I'm going to show every single campus in the district and where we were in November in terms of student attendance face-to-face and where we are today. And so it was about the November, December timeframe when we started reflecting on quarter two and saying it's time, we've got some identified kids, this isn't working for it. And as you guys are all aware, we started to really connect with them individually and invite them back face to face. And so through those efforts over the last several months, we've seen a significant improvement. we want to be 100%. So my initial comment was that not as much as we want to be, but we're very satisfied with the progress. And again, I'll show the numbers specifically here. So that's good.
Of those students that you paid, was it 35? Have there been any significant issues, emotional, behavioral, those from that group of students?
So interestingly, we have some kids who have come back, for example, ninth grade, never been on the ninth grade campus. And so they're entering the school, January, February, March, because it's the first day of school. And so it's really about how do we help them in entry, how do we help them connect with their teachers. It's going to be different to connect them online when they're face-to-face and into the peers in the class. So I think there's an adjustment period. I also think that the norms, if you will, and the expectations and procedures for when you're on virtual and when you're in a classroom are very different. And so teachers are having to reteach those norms, those procedures, and help kids make re-entry into the classroom. Those kids adjust pretty well, so we're looking to know, depending on where they were when they entered, it can just take a little while.
Do you anticipate the same issues in September for all applicants? I mean, it's usually refreshing their memories on the first day of school, but some of them, this is going to be the first day on campus in almost 2 years.
Yes.
So, we're going to have that issue.
Yes, sir. We're definitely going to have a multi-year plan for attempting to recover some unfinished learning. Definitely seeing the data throughout the year shows that kids are growing. In our district, about 70% of the rate that they would normally be growing. So we definitely have substantial work efficiency. We've got a lot more unfinished learning than we would otherwise have had. The other thing is, I'll talk a little bit more about this in a little bit as well, but we did survey our community and inquire about the percentage of, for any students who intended or would have requested to start remotely next year. And we're probably between 6 to 8% of our population, so we're fully expecting over 90% of our students to be back face-to-face this fall, based on the applications we've been receiving for remote requests. And so many of those students haven't been in school since last March. And so we're going to see a lot of that. Some of them are returning as Shin campus that we weren't at last year. So there's that. And then can't speak quantitatively to this yet, but we're certainly seeing increases in the numbers of students that have experienced some form of, I guess I'll call trauma, whether that was loss, whether that was income issues in the home as a result of what's happened in the last year. And so maybe for the first time they've experienced things that they hadn't ever experienced before. And so I guess the scope of what we're anticipating of students that are going to need some additional support, we're anticipating that to be substantially increased. And so for those reasons, we're talking a lot about how can we support them in instruction in a social emotional way, and how can we also work more closely with our community schools partners and our counselors to kind of really get more comprehensive in our efforts to academic supports for the child and family, possibly not just for next year, but for the rest of the time that they're in our school system. So it's going to require us to enhance or build upon the things that we've already had in place. And so we're realizing that they're looking at signaling in the second quarter and now third quarter that we're going to have to really put some effort, some resources behind. So Aaron.
An opportunity maybe for some smaller, more focused, all back to school nights instead of one big.
Buy the things that you need. We're going to have to probably do that a little bit longer and a little bit more because some kids won't have been on the campus for a couple of years, and so we're going to have to reacquaint them with all of those routines and procedures.
Thank you.
Ms. Dell, do you have any questions? Thank you so much.
Yes, sir. We'll ask for our fantastic leader of personnel services program in the district, Jalen Hart, who's ready to provide the board with the first of several department updates for this evening. In your electronic packet, just under that agenda item, you'll see a link to the presentation that Nurse Hart has on the screen. If you want to follow along on your electronic devices, you can follow along on the monitor. But I will point out also, and I apologize, that actually in your miscellaneous packet, you have the correct version. In the electronic packet, we have the right cover page, it says health services, but it's followed by the student services presentation in your electronic packet. So, we corrected that in the hard copy. So, sorry about that, Gerard. Oh, doctor, nice. You feel like a doctor.
Good evening, and thank you for the opportunity to highlight our business department. For priority one, the teaching and learning environment, a typical health service day revolves around supporting the teaching and learning environment, whether it's sending ill students home or getting them patched up and back to class. Our goals for this year focus on our vision and hearing process, appropriate and effective professional development, and the creation of our department handbook. We all know that the ability to hear and see is vital to the learning environment. Last school year, we added a few steps to the communication piece of our vision and hearing process. As we did not get to collect complete data from the 1920 school year, we decided to continue with this goal for the current year to determine if this communication piece would impact the success of our program. We obviously want to help every student perform to the best of their ability in the classroom, so we are continually engaging with families to support the needs of these students, whether it's phone calls, personal phone calls to parents, letters, whatever we can do to give these parents community support for these issues. And we're on target to meet these goals by the end of the school year. Prior to the start of the 2021 school year, we identified that contact tracing related to COVID cases would be a large part of our duties this year. So in partnership with Johns Hopkins University, our nurses completed the contact tracing courses prior to even returning back to campus. So, and as of today, we contact trace well over 600, I would say, COVID-related cases. And that professional development has definitely served us well. And currently, our department handbook is in its final draft and will be ready for posting by the end of April. Priority two is in relation to our key performance indicator for our department. So this is just one example in relation to the goal that I spoke of earlier with our vision and hearing process. And so what's great about this KPI is it allowed our staff to visualize where they were as compared with some of the other schools, and then where they're at on the continuum, where we started in September, we should have been here, say by December, why weren't we there? And it also allowed me to look at each campus. I have one that's identical to this, but for each campus, and I could see, well, how come Palm Valley's done and Tradition's not, and work with those nurses to make sure that we were getting what we needed to accomplish in a timely manner. So we'll move on to priority three, which is our partnerships. So as I spoke earlier, our department worked closely with San Antonio Metropolitan Health District this year, related to COVID cases. And by law, we are required to report these cases, but what was interesting about this year was we weren't just speaking to anybody at the health department. They actually assigned a nurse to each district in San Antonio, Bexar County. So we got to speak to the same person each time, which was very helpful for us because they knew what was happening in our district. They knew each case. We talked over each case. We went over our contact tracing results, and they were able to give us recommendations for what to do with individuals who are testing positive, and then maybe people that were exposed on campus. It was a great partnership with them. Another one is Community Labs, which was a new partnership for our district this year. Together with them, we coordinated over 20,000 COVID tests for our staff and students. And those tests were done weekly on Mondays and Tuesdays throughout the district. Our next slide is budget. Our funds directly align with the priorities of the district. Our department created and distributed over 700 classroom first aid kits at the beginning of the year. And so from the smallest Band-Aid to the computers we use for documentation and the printers that we use for COVID testing tickets, our budget is well spent on the needs of our staff. So what's next? Well, that depends on what COVID's gonna look like for 2022. Will we continue with the big three, masking, social distancing, and hand hygiene? I hope we continue with the hand hygiene part myself. Or will we be administering vaccines to students? So that's something that we're looking to in the future. That might be happening. We did that years ago when H1N1 was around. So we'll probably be looking at maybe a partnership hopefully with Metro Health, and maybe that's something that we can offer for students, on campus. We'll see. To date, I have offered over 700 COVID vaccine appointments to employees. So just a little tidbit on that. The other thing we're looking at is a little bit more mental health training. There's a lot of training now focused for schools and school nurses, and then how we can help with our counselors, and help with the students who are having issues like you mentioned earlier. Now that they're going to be returning back to campus. Thank you again for the opportunity. I would love to hear any questions.
Mr. Joe, you have any questions?
I had an opportunity to work with Dr. Jillian Wu from the Metro Health Department last week with a pilot vaccination clinic that we did and vaccinated about 200 people. So I guess what I'm saying is I just appreciate the collaboration and the partnership, and I know how you work with Metro Health, watching the dashboard and keeping our kids safe, and keeping the staff safe, and keeping everybody safe. And I know that's no small undertaking, so I just wanted to say to us that.
We're not alone in that. We've had leadership from the top, we're just a portion of the great things that the district is doing for our students. Thank you.
Thank you so much.
Thank you, Dr. Clark.
All right, we'll go on to 6.3, student services, social service department updates.
Mr. Calvin Hernandez here with us this evening, and in your electronic packet under 6.3, past the agenda item, you'll see their presentation there electronically, and/or you can follow along on monitor.
Good evening, Mr. Piscato, President Massaco, and fellow board members. We have some listing and city services that include social services, health services, counseling services. Listening to the needs of our students, families, and staff around the world. We connect with the COVID resource to meet their needs. We continuously work with on-campus and department staff to make therapies and the way that affects the environment. And we're all trained to prepare to listen and respond. We all know that it takes more to treat a child with 3 days. Starting with one. Student. It's really focused on these like problems that we have with our parents. For instance, like now, we do gap analysis, the process, we continue to have ongoing training for our students there, which is especially important. These departments regularly develop our staff. So it's encourage additionally, information regarding decisions. That's still not possible. But provide teacher representation of behavioral analysts, current patterns of behavior. Two other departments that we did not earlier. Student only ones indicated that both their departments need the language as well. Your consent for social service feedback, that's what the requirement is. So you see, September, a lot of registrations, a lot of the folks who are school. Registration. So we basically monitor the family served and the response to regulation. So we go registration time, and also the December or how I don't know how to call it right now. They did. Additionally, it's been a significant amount of effort on my part to get something on this knowledge. We also try to simulate mindset skills with places that are out placements. School counseling tries to find areas of possible to ensure that they're more school counseling. Don't focus on non-contact. Our goal is to spend more time with students who directly help in the social emotional health services they try to do. And currently we're on the back to meet all of our goals for each of those departments.
Priority 3 is inclusive and collaborative partnerships. Our district continues to partner with organizations in meaningful ways to serve families. We saw in this last year that food security has been an issue for families in our community, but all over the city. So we're fortunate to partner with Grace Michael Church, and we provided approximately 300 boxes of food to families in the district. In addition to that, through communities and schools, they provided 200 boxes of food to families within the Hunt Valley, Salado, and Highland Forest school districts. So we are doing our very best just to provide basic needs that we feel like will impact kids in the classroom in the long term. With the addition of a site coordinator through communities and schools at East Central High School, communities and schools continues to provide services to meet student and family needs. An East Central Attendance Committee was also created to gain feedback from community stakeholders to address chronic absences. The goal of this attendance committee is to continue to partner with these stakeholders to seek ways to improve attendance. Our district has sought agreements with Texas Child Health Access through telemedicine, or TCHAT, and Child Safe. TCHAT is a program that can assist students who are experiencing a mental health crisis. So this provides, through the school council, make a referral, so this provides the student to receive telemedicine services in a quicker way than having to make an appointment, possibly get their a family trying to get their student somewhere. They can, a referral can be made, if the parent wants to, they can find it within the school or from their car, make this telephone call, and seek immediate assistance for their child in an effort to receive the basic services that they need for mental health. In addition, through partnership with Child Safe, they'll be providing training opportunities for students and families on topics such as trafficking, child abuse, and internet safety. We most recently partnered with Texas A&M San Antonio to improve family and school engagement. Some families from Pecan Valley were invited to a family night at the museum or private event where they engaged in an academic lesson, and after the lesson they were able to tour the museum with their family. So as student services, each and every day, we truly embrace the opportunity that we get to serve families. We don't have to serve families, but we embrace the opportunity that we get to service them and provide services that we know are going to impact them in the classroom in the long run. Priority 4
resources and operational excellence. We meet regularly to ensure we are using resources effectively, working on things that impact kids, money going to the right places to impact classroom performance, and to identify any gaps in budgets. So currently, one of the things we wanted to highlight is that through student services and social services, we are stewards of the special needs fund, which are funds donated money that we use to provide services for families. So those needs vary from rental assistance to a car seat to medication assistance. It really just depends on the needs of the family. So again, that offers an opportunity to listen to what the needs are of that family and to see how we can best serve.
Lastly, Golden Road, we scored 90% of hiring on the evaluation service and business. The college change survey said that teachers not just work, they work on student service department continues to strive to provide exceptional customer service. So based on the fact that we got the staff, because support for employees, these loans basically what the security strategy stuff, what it happened. So ultimately, thanks to our technology, there's better data than this time. A lot of information on the yoga, on the music, you name it, it's got a lot of different exercises to help our employees. And so again, just collaboration with Marathon, we're going to continue to promote that as our next steps. As I said, constantly based on feedback, they even added recipes now for dietitians, recipes and healthy. So that's a little customer that they just created. So our other step that we're going to do is recognize the need for improvement in online registration, student registration. As we move to the new student information system this summer, we developed a system in advance to provide exceptional experience on the online registration to make sure that it's aligned with the center that will be taking place this summer. We do already have current return student registration opened up. We started on April 1st, which is the first. So we've always had registration in July. But knowing that transformation was going to happen, that switch to consider it going to happen in July, we didn't want to wait for them to make that decision, so we can go after and make that move now. And so currently we have registration on every campus online. And then also, if needed, they have full copies of each campus if they prefer to register. So we're just trying to meet the needs of all of our families and knowing that some of them not have a computer or device, is that our campuses are equipped and evidence they want to come in and register. But again, thank you for allowing us the opportunity to showcase student services. This close is passing around another message. Our last message is we are constantly going to look for ways to market and communicate our services and our resources to help our families. And so we've always had a missing carrier to be partnered with United Way. Last year, 211 is a free phone number that anyone can call at any time, at 911. But also you see the SACRD.org. Plug in that zip code, we get a resource that's in that area. But on the backside, though, every time we go on the home visit, we're like, do you have a phone number to the consultation? Do you have a phone number to the ECISD? Well, now they're all on the backside, right? So now we can visit the family. They got a great phone number to every campus because I was having to do that the right time, right? Trying to write down the phone number to the campus. So now it's simple to just drop it off with our board hackers that we already have. And so that's the way to be more efficient on our home visits to help our community. So again, thank you for allowing us the opportunity to showcase student services. And again, we have a great team. Very fortunate to do this for our community. Any questions?
Office and handbook development.
Yes.
I'm not seeing all 5 bars here. Is there?
So the counseling hasn't done there. They spent a lot of that focus on the gap analysis. They went through elementary, met together, and the counseling team, the secondary school met together. So in the secondary school, they have a lot more students. So they had more conversation in regards to figure out what else can we do. You can help. They do a lot of scheduling, right? So whereas at the elementary level, the one that does the scheduling basically the 10th person that assigns that schedule. So at the our district meet. Chad and Olivia, we're working right now with their own team designing that. So that will be started up here as the next step. That we're working with. As they were listening to all the different needs are coming, that's servicing the students remotely and in person. Because we do know, based on the conversations people have prior to, is that we know that we're going to get a ripple effect coming in August. And so they're already working on ways of how to prepare to service to families as well.
And then would you say that by having that key performance indicator, that you and your team were able to identify an opportunity to kind of look at why the counseling group might have been lagging behind and discovered that they prioritized kind of doing the gap analysis and kind of got behind on the handbook, so we had to make some adjustments in hopes of meeting that goal with the handbook.
Yes, sir. Yes, sir. So it's the anticipated completion date for theirs is still going to be May?
Yes, sir. So that's going to be the goal. So when they meet back, they have meetings monthly, and so what are conversations that they're having in regards to that handbook. Right now, they're having remote learning meetings, and then they're also having face-to-face meetings, right? So that's when we're partnered with TChat. That was a big piece on it because right now the teachers that they have, we're trying to partner with as many mental health agencies as possible to assist our families. Because we know that there are going to be a lot of students and only the students having on campus, so things have to deal with when a student comes in March for the very first time that we receive these phone calls. Some parents are very nervous. And so I'm dropping off my son at school and he hasn't seen the hallway. And so parents are doing a great job of communicating with protocols, but at the same time there's nervousness from the families as to that it's okay. Our kids are resistant, right? They're resilient and they'll find a way. The key is to keep communicating as to where the company is located, right? So when they get in a situation where they feel like edge and threat or those nervousness and get into the families, is to show them, you know, where your counselor is, you know, where they're located, that way they can, get there. And so that's the one thing that we talk about the assistant principals as well, is to, we all provide that safe learning environment and making sure that when they come in for the first time, that they're a smiling face. That's the best thing that can make them, welcome to it. Okay, thank you.
Ms. Brazil, you got anything? No questions?
Can we still do easy forwards?
Yes, ma'am. Every month.
Okay. And I saw the new, it's like health safety better
Yes.
health use.
Yes, ma'am. And so we signed an MOU with them. So they do provide online training for our parents or anyone who can see that we've done that MOU on our campus can bring them on campus to provide a presentation or even virtually. But they do online safety trainings, 10 a.m., 11 a.m. so any parent can get on that and at their schedule whenever they provide those opportunities. But they're going to provide a lot of different resources for us that we haven't been able to reach some other agencies.
Wow, okay, thank you. This is challenges, not plus, this is required.
Yes, ma'am. And we do have over, we're approaching 1,100 students that have been identified EC carers. And so those get tagged in the system, and it's a special alert. And so for next year, for example, we already have a immediate suspend that child. It'll say special alert, and so when they click on it, it'll say EC care to have a case by it. And they'll kind of let them know, like, well, today, important day, what's going on. And so in the system, that person may have had a significant loss or something that happened on that day. And so I know now that it's still saying, well, I'm sorry, you went through that 2 years ago. Let's get you, down to the counselor so this thing will be seen by itself.
Thank you so much. Appreciate that.
Thank you.
We will move on to 6.4, risk management and purchasing department update.
So under 6.4, you'll see two different presentations. We've separated risk management and purchasing. So we'll have our director of risk management, Shannon Burns, provide that update. And we decided to separate that because now with our employee pay, there's a substantial amount of additional information in that department that I wanted to make sure the board was able to be exposed to.
Alright,
Good evening, President Gale, Senate, and Board of Trustees. For priority one, we focus on our safety committee meeting attendance. So our safety committee is comprised of department leaders and campus assistant principals. And the purpose of the meeting was to discuss our workers' comp trending reports, our relevant safety topics, and facilities inspections. And then the committee members take that information back to the department to promote safety. So attendance is based on a minimum of one representative from each department or campus attending the meeting. And so we met that goal in our first meeting in September, but we fell short in December. And so we recognize that if a campus principal has a conflict for that day, then obviously they're absent. So we're going to be looking into promoting that attendance and seeing if they can send somebody else in their place if they're unable to attend the meeting. Okay. So for priority two, the goal is to provide competitive health coverage for our staff through lower premiums, as well as providing free primary care through the CARE ATC Health and Wellness Clinic. And members can enjoy free primary care for sick visits, lab visits, and that reduces the cost for both the employee and the plan while improving health outcomes. And we're going to be looking at a KPI here in just a minute for that. Priority three, so the business department is focused on carefully reviewing our MOUs and contracts that we have with our collaborative partners. And we review those to make sure that the terms are advantageous to the district, to protect our students and our staff. And so for our next steps, we're going to be looking at focusing on data sharing agreements that go with those contracts and to continue to provide cybersecurity training and best practices for our staff. Okay. So for priority four, we focus on the district's greatest resource, which is our human resources. And so the district pays annual contributions to the tax and risk management for our workers' comp coverage. And then the fund then pays out claims on behalf of the district that may cost time for the employee or medical expenses for their treatment. The chart compares our claims history since we started with tests. And you can see that we've been trending downward over the last 9 years. So the blue portion represents payments that have been actually already made for claims, and the orange is for reserves. So if there's an open claim and they still expect to pay on that claim, they provide an estimate, and their estimate is shown in that orange section. So we're still barely under last year. To continue another consecutive year of trending downward. So this is really part of the results of group effort in our departments, our campuses, really working hard and focusing on the safety of their staff. So it's been a really good teamwork. Okay, so here is our KPI for our new self-funded insurance plan. That compares the UDC claims versus what we have in TRS. So starting with September 1st of 2020 to February of 2021 for the UDC plan, compared to September 2018, February 2019 of TRS, which is the most recent data we have in TRS. So this year we have an average of 850 employees that signed up for our new health plan. And with their dependents, that's 1,222 members altogether. Our gross medical claims are trending 40% lower than that same trend period at 1819 TRS. But it should be noted that TRS is a mature plan with a 12-month paying claims, and there is a lag with paying claims. So looking at this number will be, this will change over time and it will be more comparable once we have a full year under the Cigna PPC plan. Our pharmacy costs are trending 14% lower than what they were under TRS and speaking with our full-time PPC, contributes most of that to our pharmacy benefit manager of ECISD. Under our PPC plan, our admin fees are higher than we also pay the stop loss individually each participant. And we don't have as large of a pool that TRS does at this state. It has over the entire state, so our costs are going to go up because we don't have broader basis for those costs out. And then our UBC plan, we do have the clinic, so premiums are covered in the cost of the clinic. The goal is to not just save employees money on primary care, but to also encourage better health outcomes. So as of February 28th, we do have a surplus of almost $121,000 compared to TRS. That's less, but that's because we're retaining dollars and we're sending it back directly on our employees. So our next step will be to continue to promote clinic utilization. So this next slide is our visit data at the clinic from September, and this goes through March. And the wellness center is billed to employees who they have enrolled in their program. The first graph shows the total number of visits. The bar represents the total visits, and then the line represents the number of patients. So you can see that some of our patients are visiting them more than once a month. The second graph shows the number of visits per month, and the bar represents all visits. The unique visits for each individual month. So overall, 352 unique patients have visited the clinic, and that's averaging about 29% of the overall members that are on the plan. So of employees, 291, and 34% of the employees have visited the clinic. 12 out of 35 spouses, or 34% have visited the clinic, and then 49 out of 330, 14% have visited the clinic. That number is lower primarily because smaller children are still visiting their pediatrician and ordering in their medications. So, and then the last graph shows our utilization versus capacity. So the clinic capacity is roughly 346 visits per month, and it's averaging about 39% of utilization. So we're going to continue to work with our ATC to promote our employees and their attendance to
So our goal was to be able to manage, to provide a accessible healthcare plan that is less expensive for our employees, but more accessible. And they get survey data regularly, and I would say well over 90% of employees who have visited this plan said that the attention of the care they received was exceptional, that their ability to get an appointment and get it out was exceptional. And the only negative feedback that we had received to date was that on occasion we have to call to ask questions. They put a 800 number, they're routed around the talk to a person, so they're working on making that adjustment. We were also concerned that with almost 900 employees, 1,100 lives as part of the plan, that we weren't sure about the capacity of the plan. We're working at about 39% capacity right now. And it's still because our employees are doing what we all do, and that's only when we're not doing triple things. So our goal going forward is not only to provide a quality option and be able to manage claims and manage prescription claims, same revenue right back into our employees, so manage, the cost. But we also want to become more proactive as a culture of employees here at ECISD, and do annual wellness screenings and make sure that we know what our blood work says and what our vitals say, so that we can make those adjustments in our lives, so that we're not just going, we prevent being sick as opposed to only going to the doctor when we are sick. So that's kind of where we are. We feel like this first year was a lot of unknowns, but that we're trending in a really good direction, and that we feel like that things are only going to get better. And it's not for any reason other than a great team that Shannon leads, working in partnership with Carrie TC folks to really be completely transparent with the data, and then we can turn communication around back to staff and make adjustments so that we can manage the whole situation and continue to sustain this option for our employees. So lots of positive feedback. I can't even emphasize that enough. Lots of positive feedback.
Do you have any information about how many of the clinic visits are wellness visits versus remediative visits?
They slice and dice it a lot of different ways, and that is something that I can certainly incorporate in my KPI. I could tell you off the top of my head what those numbers are, but they definitely are tracking all of that. They can break it down by the number of diagnoses per visit, the number of prescriptions per patient. They break it down by the types of chronic illnesses that they are managing with the patient. So whether it's high blood pressure, high cholesterol, diabetes, asthma, those sort of things, regular well visits, anxiety or mental health visits. So they pretty much just will identify by visit type. Of course, we don't see any of the actual claims per person or anything like that, but they do. And so I can certainly include all, 20 pages of different data, but so that is something that's nice. And then we can try to follow up and target any area that we feel that our population needs the most.
So one of the goals is to promote wellness, and it would be good to know whether that needs to be
So
pushed or.
yeah, would you agree that what we have seen is that the percentage of visits that are well visits is really low proportionately to the other visits? So
I would see that, and then also the fact that the unique visits to the total visits can kind of tell me that the patient goes and maybe they get an initial exam, maybe they get blood work drawn, and then they're going back for that follow-up visit, having a discussion with the physician about what their results are and what they need to do for their health. And so a lot of times people would not go to the doctor because they're afraid it's going to cost them, but this is nice because they can just go multiple times if they want to.
yeah, so we're in the process, we're kind of collaborating on a way to incentivize that initial visit. We believe that if we get an employee in there to do that initial well visit, A, they start that proactive effort, and B, they connect with the clinic and the doctor. And if we had more time to spend on this tonight, I think I would ask Ashley to share her most recent experience, and you get an earful about how amazing her experience was, and that's just reflective of what I've heard from so many employees like that from Jordan. So I think you just got to get them connected with the clinic that first time, and then I think we'll start to see more proactive behavior. Of course, we do have the data to show if we're having an impact. So it's definitely our priority.
And their marketing team came down earlier this month and we visited about half the campuses. Then we did a Google Meet with the transportation department. They had their makeup day on that Friday, April 2nd. So we had about 53 of the transportation department personnel. And then we went to the clinic. We did on our Zoom right there from the clinic, introduced them to the staff of the clinic, the doctor at the clinic. Then we distributed some materials to the other campuses for them to put in the break room. And then we'll be having our spring open enrollment for supplemental benefits coming up in a couple of weeks. And so their team is going to come back down that week and have some more promotional materials. And, so public service announcement, anybody who does go April, May, or June, their name, gets entered into a drawing for a $125, gift certificate to try to incentivize, people to go ahead and sign up for their first visit and, see what the experience is like. So, and I appreciate y'all's support last year. It's been exciting and a lot to learn, with this new plan.
Thank you.
Thank you. We'll move on to purchasing 2021 board presentation.
Yes, sir. So that is also going to be projected on the monitor, or you could follow along in your electronic packet. Mr. Morgan will join us live momentarily. From an undisclosed location.
I will tell you all that the care that I got at the clinic was top notch and extremely personal. And I'm really trying to find out, I haven't pulled it up, I haven't there.
We hear it.
Yeah, I'm gonna be in the party.
I don't know that's not bad.
There's a meet up there.
He left, I know, he was here. It's okay, it's okay. We'll find out, I promise. Here's all I have to do, I'm right here, right here.
Can you hear me?
Yes, I'm getting back in, Matt, I'm pulling it up.
We hear it.
Ashley, can you hear me?
Yes, Matt.
That board meeting link. Oh, no.
They give us also.
Okay, so that. I told you Matt was in an undisclosed location. It's incognito.
Okay, Matt. Yay, Matt, you're with us.
Hey, can you hear me?
I'm ready to go. Go ahead, Matt.
Alright, good evening, Mr. Maximo, Mr. Discano. Members of the board, thank you for this opportunity to, present updates from the purchasing department. Priority one, during the pandemic, the department felt like it was important to streamline warehouse requisitions. The majority of the items carried by the warehouse are cleaning supplies used to sanitize facilities. Before the pandemic, it would take the warehouse requisition 4 to 5 days after final approval to get delivered. We set a goal to have these deliveries sped up to less than 2 days and made some operational changes. Currently, 52% are same-day delivery and 40% are next day. We have not had a delivery over 2 days this school year. Priority two. An area of focus for the department has been copier and print management. We have been tracking overall cost of the program and pages per student per day. The district has seen significant decrease in both cost and usage since inception. In year one, the district reduced this cost by $193,000 and is on track to continue that trend. The district utilizes services provided by Optimizon, which includes certifying accurate invoices and ensuring that our copier providers perform the scheduled maintenance on the machines and hold them accountable when these tasks are not completed. This increases the life and performance of the units while under contract with the district. The district also utilizes PaperCut, which is a software that tracks usage and provides reports to campuses and departments. The department also implemented commodity codes for the 2021 budget cycle. Currently, the district is using around 120 codes. All items requisitioned must be assigned a commodity code, and implementation of these codes brings the districts into alignment with state and federal procurement methodologies and assist on tracking types of purchases and future budgeting. Priority three. The department, in collaboration with other business departments, reviewed 95% of all contracts and memorandum of understandings. and updating procedures. The department also collaborated with CASA to conduct a demographic study. The study gave indication to the district on future growth and needs. One area of needs identified was land acquisition. So the district has partnered with a land broker to procure future school sites. Additionally, the department requested feedback through thought exchange with other business departments. After analyzing the data, the department plans on improving on the resources available to stakeholders for procurement. Priority 4. The purchasing department coordinated with Colette to convert the RCI data records of inventory into the Colette management system. Purchasing staff continues to update the inventory with additions and deletions. The department also plans to contract with Colette to do a physical inventory of the district's assets. The department is also collaborating with other departments to develop an inventory management manual for the district. This will include the items, are to be inventory and how. We will also create a continuum which will be used from implementation to an institutionalization of an optimal inventory management system. Key performance indicators. The department is focused on 3 KPIs. The first is warehouse requisition fulfillment time. The second two deal with copier and print management. KPI 1, we are exceeding expectations and have greatly reduced the amount of time for deliveries. KPI 2 and 3 have also seen tremendous reductions. The district is on track to save over $200,000 this year compared to pre-implementation of tracking usage and costs, and have seen a reduction in the pages per student per day district-wide. Next step, physical count of the district inventory assets, assist in procuring land for future school sites to meet the demand for future growth, and improve the purchasing website and manual to assist staff with procurements. To try to answer any question, there seems to be about a 5-second or 10-second delay between what I'm presenting and what's being shown on Facebook Live.
Mr. Dills, do you have any questions for Matt?
Yeah, that, you associate the drop-in copier costs too? Is it just not the same number of kids in school? Is it the new copies that we put in? Is it codes? I mean, that's a pretty substantial drop-in cost from $182,000 to $75,000. I understand there's one of those years back, we've got a little bit of school year left, but that's still less than half of the total cost last year.
Are there any questions? I knew it was Mr. Brian, but I wasn't able to hear the content of the question.
I will give you that question, we will get an answer back to the board.
It's the same way the doctor can be able to
get a better handle for that. We will move on to 6.5, personnel report. This is done.
Trustees, in your electronic packet, you'll find this month's personnel report. You'll see we had 4 resignations in the last month, and we also onboarded 40 employees. So if there's any questions you may have about any of those, let me know. And we'll make sure to get you some additional information.
We'll move on to 6.6, ECISD district update. John?
Yes, sir, trustees, this refers to an item that the board had already approved previously. This is related to the Family First Coronavirus Response Act. As you're all aware, the federal government ended its program in December. The district had the option of carrying forward a local option, which the board did approve for the district to do that. All we're bringing you tonight is an update to specify the date that the program will begin. And so in your electronic packet, the actual program document the board has previously approved to be added through June 30th, 2021. So our option for coronavirus-related leave that would qualify for up to 10 days throughout the course of the year will begin that option in January. I just wanted the board to know that there was an end date attached to what the board previously.
Good. 6.7, exit interview report.
Sir, trustees, we'll bring this to you every quarter. And this is the quarter 3 report, of course, every time employee across job categories, exit the organization, we offer them a survey to give us feedback. It's anonymous and it's optional. We encourage you strongly to give us feedback. We do use the feedback. As the board is aware, our objective is to look at the feedback and look for opportunities to improve our supportive employees from onboarding to training and development to ensuring that ultimately this is a place that develops a good decision for them to work and this opportunity to make those adjustments in sense. So this is this month's report. There were 16 surveys that we had given to existing employees. We got 3 responses this month. As is always the case with those who got interviews. You always go through all this feedback. Numbers.
Any questions? 6.8, contract renewal for 2021-2022 school year.
Yes, sir. Trustees, we're bringing you for review this evening. All of our contracts that are up for renewal. You'll see first those principals and directors that traditionally did 2-year contracts. You'll see those that are recommended for extension of those 2-year contracts listed there. You'll also see all of our 1-year contracts by location across the district. So you'll see all the employees that are multi-year being recommended for extension multi-year, and those that are being recommended for a 1-year contract. Again, it's by site. You can see all of those employees listed there, and we have to get you with any additional information as you wish, as you have more opportunity to take a closer look at any of that.
Does anybody have any questions for the contract renewal? No? All right. Move on to 6.9, COVID-19 update.
So, Mr. President, wanted to provide an overview of where we are with COVID-19 in our community. This is the very similar process to what Brandon and I had done probably more than a dozen times since the onset of the pandemic for our community through Facebook and YouTube Lives. And I know that many of you have tuned in and enjoyed the show. Set aside some of your favorites and recorded those in lieu of watching these live. But I wanted to give the board a tour of where we are today. And so starting with the COVID-19 dashboard, we can see that the risk level is low for COVID-19 spread in our community. This would be the greater San Antonio metro. And you can see the box that is surrounded by the black trim there is low, dark green. And so if you'll go to view summary statistics and records, there we go. You can see that the positivity rate is 2.4, that's green. There's been, when there's an uptick, they make the number red. As you can see, it's a very minor uptick, 0.3. The standard rate for it to be safe is a less than 5% positivity rate, which you can see in the latter part of March and up to date, we've been right at that 5 or below. And if you go up a little bit, right anywhere it says weekly positivity test, go down. Okay, so you can see that 5, where it says weekly positive test percentage of COVID tests. So of the tests that were taken that week in San Antonio, that was the percentage of those that were positive. And you can see for the last 4 weeks, we've been well below 5%. So that's excellent in the city of San Antonio. Certainly excellent as it relates to our continuous attempts to bring more and more students back into our schools. So, Brandon, if you can now go to our reentry protocol. This would be the corresponding protocol the board adopted that has actually served us exceptionally well for the entirety of the pandemic. So we use that dashboard. There you go. And we've got the corresponding colors you'll recall that match those phases. The dark green on the far left kind of gives us some direction. That far green on the dark left says it's safe to have 100% of our kids in school. We've, of course, been open for 100% of our kids for much longer than that. The recent weeks have been under 5%. It also says that, hey, let's continue with standard sanitation measures. We continue with our extensive sanitization protocols. We've been a little bit above and beyond what the requirements are, just out of an abundance of caution. We've also continued with hand sanitization, distancing to the extent possible, although the CDC did upgrade or update their recommendations around that in schools. You're all familiar with that 6 feet, and in schools, in classrooms, it's okay to be as close as 3 feet. Their only recommendation is if you're going to be inside 6 feet, to wear a mask, and we've just made those adjustments and adhered to that, and have continued to see positive outcomes. So we're following our reentry protocols we have at all stages of progress. We're not with COVID-19 in our area. Brandon, if you go down to the COVID case tracker, this is a requirement that we publish this, and of course we would have done it prior or not, because it's transparent and the right thing to do for our student, staff, and community. But you can see there that there's been 448 cases since the onset of the pandemic. 260 of those are students, 188 are staff. Of course, the 260 is out of 9,800 students. So if you do the math there, it's a very low percentage. We also track number of cases by zip code in the East Central community. And you can see that the far right is the total number of cases of the total population in that zip code. So if you look at the first one, 78152, we have 2,294 citizens in that zip code in our community. And we've had 120 cases in that zip code of COVID-19, which is 4.7% of that community that have had it at one point in time, COVID-19. But currently, there is 0.5% that are active cases, 0.5% of 2294. So you can see every zip code in the school district where we currently are, then you can see the entire county, 2,040 plus citizens, 13,000 active cases in the entire county, 5.2% of the population of their county at some point in time have had COVID-19.
Active cases, you mean total active cases currently or total?
Currently. Yeah, so where it says active, it's just right now. So 13,000 in the Bear County.
Okay.
But yeah, currently that's only 7/10 of incubated before gas, right? So then on the left, you can see we report by campus. The the number of students, number of employees, and the total number of cases throughout the course of this pandemic, and that's just a running total. So Cassidy High School, for example, has had a total of 4 students and a total of 4 employees who have had COVID-19. Whereas East Central High School has had 100 students and 54 employees for 154 total during the course of the pandemic. That's running and published in real time daily, weekly. Brandon, you can continue scrolling. This is positive cases by week, and really what I want you to see is the trends around December 7th and 8th. We saw in the city, as well as in our school district, a little bit of a spike, a little bit of an increase in positive cases, both students and staff. But then as you progress towards the more recent weeks, you'll see that we've got 1s and 2s. We had 4 at one point, March 15th, but it is declining tremendously as we've mirrored what we've seen in our city. Then if you go to testing data, this is the data for the community labs testing that Nurse Hart reported on earlier. And you can see by week the number of students and staff across the district tested and the number of positives. And of course, you can see we started with 17 positive way back in January. And it's gradually kind of dwindled down to where now we're having, 3, 2 or 3 across the district. And if citizens wanted to know, well, heck, April 12th and 13th testing, where were those 3 positive cases? You could go into that week site by site and you can see. But if you just kind of scroll there, Brandon, slowly you can kind of see site by site. If you just look at the trends, which is the far right column of positive, you can see as we've seen the last 3-4 weeks, you got zeros for several weeks at most sites, and maybe 1 here or 2 there, staff or students. So again, even site by site, we're seeing a lot of zeros, 1s and 2s at most. So now, Brandon, if you go to the student enrollment modality. So what I wanted to show here, and I believe we've got, is this what your side by side is? If you go down a little bit, actually, is this?
Yes, sir.
Okay.
If
So,
you scroll that way, I've got it. Yes, you turn around the other side. One second.
okay, just go back. So this is, actually, this is going to look at earlier. What I'm trying to show you is how many students were in the district face-to-face in November. And it should say about 48% somewhere there.
That's the top.
Okay. Oh, all right. So if you could, okay, at the bottom, green bar, right there. Right? That was in November. Okay, we had 48% of our students on any given day across the district actually here. Today, we're at 61%. So to answer the question earlier, we've got almost 20% more students actually showing up. And I believe actually there somehow in what we tried to create here, we tried to help you see what clearly. You can see the number of students that actually is by site. So if you were looking at, say, let's just say East Central High School in November, which is to the right, that's the November chart. So if you just follow East Central High School, right, you can see that we were at 30%, go right there, 30% of East Central High School students on any given day in November were actually showing up face to face. Now if we go to today, it's 50%. 20% more students at the high school actually showing up every day. So again, you can kind of see that pretty substantial increase in every campus since the time that Dr. Fuller referred to earlier when we looked at quarter 2 and said, kids are really starting to be off track. We need to start really targeting the students and dividing them back into our buildings. And so with that persistent effort, and I think with the data suggesting that kids can and staff are safe in our buildings and mirroring the positive data in our greater San Antonio area. The combined effort, I think, is really starting to see us bring more and more students back into our buildings. And so the last thing I wanted to share was the CDC masking guidelines. And so in light of kind of all of the positive improvements around COVID-19, CDC came out with some guidelines for masks in schools. And so what we've already begun to operationalize is that, when students are outside of 6 feet, it is appropriate for them not to wear masks. But it specifies by the CDC what we're talking about here. So when students are able to comfortably be beyond 6 feet in a learning setting, it is possible for mask wearing to be a little more flexible, right? And if you can, and this is, by the way, I went ahead and put a copy of this in your packet as well. But if you'll scroll, it just proved that the CDC has pretty much specified, when it would really strongly recommend mask wearing and where it would say that they can be considered. It's not saying don't wear it, it's just saying you can be a little more flexible there. So when you're in recess or physical education, doing physical activity, okay, now, you can choose not to wear it. If you're in band, choir, music class, and you're playing instruments and such, okay, now consider not wearing masks during those activities. If you're eating during lunch, etc., beyond 6 feet, okay, with those masks down. But if you're in an assembly or in an event where students are in close contact, you gotta wear masks. So in passing periods in the hallways, the students are in close proximity, within 6 feet in classrooms or in other learning spaces, masks are necessary. So with those guidelines, we feel like we're in alignment with the CDC. That's also following the recommendations to align with mental health. And we feel like the best benefit of continuing to do this, and Jalen, you can jump in at any time, is when we have the occasional positive result for an exposure to COVID-19, when masks were worn when they're supposed to be worn, the only person affected generally is the person that's positive or the person that's exposed. We keep more of our employees at work more of the time, and we got more of our students in class more of the time. So more than anything, the masks help us in the contact tracing situation. Now that we've got really, really safe COVID-19 conditions. Jalen, is there anything to add to any of that?
Unless you have some questions regarding it, if it's not something on campus, you're right, it's contact tracing. We've set such great parameters for what we're supposed to be in school that it's made our jobs easier. We go in and talk to teachers, they can usually pinpoint the one student who isn't, and, you're doing a great job of making sure that those kids are, separated appropriately, so if there is a positive, that student isn't affected. We see more issues with our little ones because they just don't understand, that issue. So we've had to quarantine more of those type of kids because, they don't understand, they don't get it, they don't know where, they want to take it off, that kind of thing. But in general, I think the guidelines that we follow have worked very well for our district. In looking at the numbers of people that have quarantined, we haven't had a lot of positives out of those that have quarantined, which is great. I mean, even though we may have identified a lapse in what we're doing, we're doing a lot of things, other things right too, along with it. Safe. So, I think this is going to, we can continue this, it's just going to benefit us.
You got comment, question?
Good information, appreciate it. All right, we'll move on to 6.10, upcoming events.
In your miscellaneous packet, pay attention to some occasional event activities. The silent auction open today virtually, remotely. You can access that foundation through our district website, right on the homepage, among other places. but the auction will run from now through the 22nd. The actual gala event is going to happen virtually from 6:30 to 8 on the 22nd. You'll also begin to see on the 23rd and throughout the entire month of May a whole lot of activities, inductions, banquets, performances, and the exciting part about it is that all of these are exclusive. And we weren't able to do this last year. And so you'll see the NHS induction, you'll see the dance spring show on the 30th of May. You'll see that we have prom. We're actually going to be able to host a prom for students with really nice protocol for keeping everyone safe and be at the high school campus, and seniors and families and staff are really excited. We have the superintendent student of the month ceremony at Patterson in person on the 5th, choir spring show, color guard spring show, FFA banquet, academic achievement awards in the Hornet Stadium. So that's going to be different than we've ever done. And hard to believe that on the 29th we'll be graduating, and this year will be in the Alamo Dome, as you're aware. So a whole lot going on in May. So, mark your calendars, any of those events you may be able to pop into. The community, certainly staff always love to see you. Our next regularly scheduled board meeting is actually a little bit earlier. That would be the annual service awards. And of course, we'll host that at Patterson like we did last year. The high schools will start at 6 o'clock rather than 6:30 for those service awards. And then there's work paper stuff on the 28th. We've got Memorial Day holiday on the 31st and the graduation rehearsal on the 26th. Super busy month in May. There are a lot of opportunities to engage with students in the classroom. May 29th, yes sir, 9 o'clock at the Alamo Dome, and we'll send you some specific details. They're reconciling right now with the Alamo Dome, how many tickets they have available, that they can provide each graduate, etc., getting parking details ironed out. So pretty soon, actually the service award PCK will provide a packet for all trustees. We'll include the graduate list and all those sorts of things. So, more information.
Welcome everybody to come on May 29th and take part in me, sweating bullets and speaking in front of a few thousand people, which I really don't like to do, but it should be fun and enjoyable for most of y'all.
I think the Alamo Dome is about 8 or 9,000.
Yes, I'm looking forward to
With
it.
a jumbo truck.
Yeah.
Huge jumbo truck.
Y'all please show up. All right, we'll move on to item 7, action agenda. 7.1, Foundation Dixie Stars donation. Mr. Piscano?
Yes, sir. Per board policy CDC local, the board may accept or request or gift of money or property on behalf of the district is valued at $5,000 or greater. Tonight, we're bringing to you a donation that has come before for both the Dixie Stars Foundation as well as our Seed Foundation. So Dixie Stars provides $5,000 and our Essential Foundation provides $6,000 for a total of $11,000 in an effort to support our summer enrichment programs, our Superstars Camp for students throughout the summer. And it is a fantastic opportunity for our students, and it's certainly financial resources that are put to fantastic use. So we cannot receive these donations without board approval. We have to answer some questions before that.
Dale, you have any questions? In regards to anybody else? All right.
Mr. President, I recommend board approval of the Essential Foundation and Dixie Stars Foundation donations as presented.
We have a recommendation from the superintendent to approve the Essential Foundation and Dixie Stars Foundation donation. Do I have a motion? We have a motion from Mr. Garza. Do I have a second?
Second.
A second from Ms. Del Brazil. All in favor?
Aye.
All opposed? Motion carries. We will move on to 7.2, budget amendment number 2021-03, local maintenance. Mr. Scott?
Yes, sir, trustees, our facility management team got together, as they always do this time of year, collaborating with district leaders across campuses and departments to determine what our summer maintenance projects needed to entail. After prioritizing said projects and really being mindful of the district's needs potentially for some future facility property, we really wanted to be thoughtful about how we were using fund balance, and so in this particular case, we were able to look at budget allocations and prioritize some of our summer projects, which will include things such as a high school air handler replacement, updating controls for chillers, laser grading for athletic fields, at the high school, replacing boilers at Heritage, replacing the HVAC system at Legacy, replacing some damaged pipes at Oak Crest, and others. And so for this particular budget amendment, we were able to find some revenue in budget code 51, which is for plant maintenance, and what we're asking the board to consider tonight is allowing for a transfer from function 51 to function 81, which would allow us to pay for these summer projects out of facility improvement dollars. And so our budget transfer request from plant maintenance, function 51, is for $275,000 to be transferred to function 81, facility improvements, which would leave our balance at $1,039,338, which would allow us to take care of those projects and any unforeseen over the upcoming months.
Anybody have any questions regarding that? Mr. Brazil?
Mr. President, I recommend board approval of budget amendment number 2021-03, local maintenance, as presented.
We have a recommendation from the superintendent to approve the budget amendment number 2021-03, local maintenance, as presented. Have a motion? So moved. A motion from Mr. Victor Garza. Have a second? Have a second from Mario Barrientos. All in favor? All opposed? Motion carries. We'll move on to the consent agenda. Is there anyone that's like to pull anything from the consent agenda? No? Do I have a motion to accept the consent agenda as presented? We have a motion from Mr. Steve Bryan, second from Mr. Victor Garza. All in favor? Aye. All opposed? Motion carries. Move on to- All in favor? All opposed?